So I'd like to ask you some questions and maybe you could help us get some clarity on where we stand with everything. Um, so the first question is the one we always have, which is the question is, there's a whole bunch of people saying to eat a whole food plant-based diet, and conference is filled with them. And there's a whole bunch of smart credentialed people who are saying eat a keto or a paleo or a low carb diet and don't have processed foods and sugars and stuff like that, but definitely include grass-fed beef and wild-caught fish and eggs in your diet. And what is the evidence show? What does the science show for people who want to avoid disease? What does the science show regarding that diet versus a whole food plant-based diet?
Go ahead, Pam, if you want to go first.
Okay. I think the first thing, something we talk about at Wellness Forum often with our clients and members is the tyranny of the experts. In other words, this expert, that expert, this doctor says, that doctor says, there's no sense that can ever be made of this as long as that's the way the discussion goes. So you have to separate who's saying it and who's an expert. And you really have to look at the information underlying the question that you're asking, right? Because there are right and wrong answers to things, particularly if you apply some rules of evidence. And that's one of the things that I think has been our strength for the last 3 decades, which is it isn't just I found a study and let me tell you what it is. It's showing consumers how to read the medical literature to determine what's right and wrong. I think the short answer to your question is we can look around the world and see what is the right diet to eat. The Okinawan women, most of their diet is purple sweet potatoes, right? They're living on a plant-based diet, a starchy plant-based diet. And then you can look at the Maasai in Africa. They live on a carnivore diet. Their average lifespan is their mid-40s. So I guess if that's what you're looking for, it's a great diet to pick up. The keto diet, by the way, is very useful for a couple of things. You can keep a brain cancer patient alive for a long time that way, in some cases. It also works for epileptic children, but it's been used for a long time with epileptic children, and we have very good data on what happens to those children throughout their life, and they spend their whole life getting over the damage that's done from that diet. So it's the misapplication of the keto diet that's an issue here. So if you take a look at the evidence, it very strongly points to the longest life expectancy comes from eating a plant-centered diet. Where we depart a little bit is I've never told people it must be vegan. And I don't want that to become the thing that makes it not sustainable, because a less than perfect diet sustained for 20 years is much better than a perfect diet sustained for 6-week periods and you can't hang on to it. So we've never taught a vegan diet, but plant-centered is just unquestionable. That's where the evidence points.
And to go further with that, when we look at just overall health parameters, so going back to the ketogenic diet, so in my practice, a large percentage of my patients that I see are cancer patients. So they're kind of shifting in because of the concept of, which has been around there for many decades, of starving cancer cells, right? And the glucose and the Warburg effect and all these kind of cancer cell metabolic functioning with diet, and how we can control cancer growth or cell metabolism with dietary choices. But what's happening is that when we see, like, and I was in one of the original groups of people at Johns Hopkins in 2008, actually showing in the beginning, we thought, well, hey, maybe we can kind of starve the cancer of the excess glucose. And in these patients, and we had 4 different types of cancer. One was brain, one was colon, one was lung and breast. Is that there was a reduction, for example, in the beginning of some of the tumor growth. And that's just because we're cutting out all the excess ultra processed, highly refined carbohydrates. So of course, everybody will get better. They'll lose some weight, on a ketogenic diet, the first what I call honeymoon period, when you're not eating all you can eat, breadsticks, donuts, and foot-long Subway sandwiches, then yes, there's going to be some, that we shouldn't be eating that to begin with, right? But there was a little bit of a decrease. But what happened was then in the study, and this is what the industry took, they took that little dip and then they launched it out, keto, keto, keto. But then we saw a plateau of the tumors, and then we started to see an increase. And then later on, there were studies looking at, well, what was causing that increase? one of the things that I've been an advocate or a kind of a promoter of looking at is like, well, maybe it's because they're shifting so much to a pro-inflammatory diet, lack of a lot of antioxidants, no phytonutrients, no fiber, pretty much, and just a high, it's not a heavy nutrient dense diet, right? It was a highly, just protein kind of rich diet, but it wasn't full of all the anti-cancer molecules, like phytonutrients and antioxidants, and even the fiber supporting the microbiome. But it wasn't until just recently, and actually that was in 2010, they did a study where once they put the animals completely in a ketogenic diet, it actually did show increase not only in growth of tumor after a period of time, because the cancer cell will actually switch its metabolic function to actually use the ketones as fuel, which was surprising to a lot of people. But more importantly, just last month, the data came out was that they discovered that the high intake of saturated fat in the diet actually triggers a receptor called CD36. And now we're actually starting to outline the mechanism of what we call the metastasis of a cancer. And so on one level, yeah, cutting down some of these extraneous things can be beneficial short term, but it's not a long-term benefit. And that's why we have to be shifting more towards what I consider a plant-based diet. And I totally agree with Pam on the ideas that, in my practice, I always tell my patients, I'm a risk reductionist, I'm not a perfectionist. Right. So the idea is that if I can get someone where their lipids are now completely under control, their A1C is good, their thyroid's good, all their inflammatory markers, if we do an autoimmune panel or an inflammatory panel, and they're all down to normal, then if they say, well, hey, what about on a holiday or when I'm traveling or hey, I'm going someplace and I want to go, I'm not the one to judge on that. My goal is to reduce their risk of all the kind of most common top 10 diseases that people die from, like heart disease and cancer and stroke and, all those other things. And after that, then again, I think I totally agree with Pam, like to make things sustainable for people, I think there's too much of these extremes. And even there's extremes within each of these groups of the animal protein being super carnivore and then and the plant-based, they're being SOS or whatever, or, you can't have this or you can't have that, or you can't have now it's going to be raw. This is also kind of not realistically to be something that the average person could comply to or actually carry through.
I'd like to make a comment. I think you're right about the keto diet not being a permanent fix for cancer patients, but there are some exceptions to the rule, number one. A study just came out, and I don't have it in front of me. I can get it for you if you'd like to see it, but this was on specifically glioblastoma. There was no question that the keto diet prolonged the life of those people significantly by years compared to the non-keto diet. So I think there's specific applications where it does work long term. I think part of the problem is the misapplication of it. If you have a breast tumor that's contained and it can be taken out, you don't need to be on a keto diet. I see a lot of people doing that sort of thing. It's like over treatment, right? It's over treatment and it's not the appropriate match. The other thing is because that term keto has been thrown around so much, there are people claiming to eat a keto diet, but they really don't know if they're in ketosis or not. They're just living it up with fat. And that's an entirely different situation than a very carefully medically calibrated where you're measuring your ketones several times a day, because that's what you have to do with epileptic children. If you're going to make them former epileptics, and that happens a significant percentage of the time. So the rigor attached to this diet, people need to think about it before they go down that path, make sure that they're candidates for it. And I would argue that for a glioblastoma patient, you have few other options at this point in time, at least based on what we know right now. And then it has to be measured and calibrated. And everybody's different. Even how long you can go for a walk without throwing yourself out of ketosis has to be determined in the early part of it.
Yeah, when we look at, like, for example, with one of our patients that was at least in our practice, which was the longest survivor of glioblastoma stage 4 recurrent twice, which was 12 years. That we had, luckily for her, is that we didn't do a ketogenic diet, right? Because the idea is with all our cancer patients, we have to test where they're at, right? So we test their nutrients, we test their microbiome, we look at their inflammatory markers, we look at all the labs. If the labs are doing great, then we need to keep on the diet. If the labs start to slide, though, then we should modify the diet, obviously. But I think where a lot of people, they jump into any kind of diet is, and even I'm going to talk about even my plant-based patients, right? I have a lot of people come in and I'm plant-based, I'm plant-forward, or I'm eating Mediterranean or healthy or clean, whatever they want to say. And I'm like, let's just put it to the test. Because if they have any kind of condition that has an itis on the end of the term, having some kind of inflammatory response, if they're coming in with prescription medications treating symptoms, or they're having complaints, then they haven't really optimized a diet that's correct for them yet. And then we have to measure that. And even when people eat perfect, what they think is a perfect diet, our microbiome is so unique that they have everybody has a nutritional deficiency on some level, meaning we're not 100% what you eat, 100% in, 100% out. We're not robots, for example. So if I have, 3 people in my room, if all 3 of us right now on this panel here, and if we all eat the same foods, and we all take the same supplements, our nutrition test would be completely different. Our microbiome test would be completely different. Our food sensitivity test would be completely different. Our labs will be slightly different. Even if they might be well or in the normal range, they're slightly different because that's how individually unique we are. And so the goal for us, or at least the way I approach things, is going to be like, well, how do we then individually tweak and modify these things so that we are putting each person to the test and let's optimize their function.
So based on all of your experience, all your research, all the data, all the science, if someone said, I have the motivation, the time, the money, I'll do whatever Dr. Pai and Dr. Popper say, tell me exactly what to do. I want to prevent cancer, heart disease, Alzheimer's, chronic kidney disease, arthritis, osteoporosis. What exactly would you tell us to do? And what exactly would you tell us to do? And what % chance do you think it would reduce our risk of getting these scary diseases?
I'll go. I think the first thing when you talk about risk reduction, you cannot live a risk-free life. In the process of trying to live a risk-free life, you induce more risk. And so I teach by analogy. So I tell people, listen, let's first set some parameters. I drive a car and I have insurance and I don't speed and I'm slow in the school zone and I don't drink and drive and I observe the traffic signals and I do everything I can, but that doesn't mean I'm not going to ever have an accident. Somebody can plow into the back of me, right? So to a certain extent, you reduce your risk as much as you can, and then you forget about it and you live your life because you can paralyze yourself thinking about all the things that can happen. I mean, it's a psychological disorder to live this way. You need counseling if all you ever think about is what bad could happen, regardless of your best efforts. So let's put that out there first. I think the second thing is the biggest change that's happened in my practice since I began 30 years ago is paying attention to more things. Like I used to be very myopic about diet. And I think it's important. I mean, the average person eats 1 ton of food. Think about what that looks like on the street in front of your house, right? It's a lot. So it's going to have an impact. But you're also a product of the exercise you get, the sunshine you get, your mental mindset, your happiness, your psychological state, the sleep, the way you live your life, your relationships with other people. There's a holism that I think we have to pay attention to. I have seen some super miserable, dogmatic, nasty plant eaters, and they're not going to live a real long time because that doesn't serve you, right? So let's pay attention to the entire person and what's going on with that person. From a diet standpoint, our parameters are very clear. We use a food pyramid to show people how to eat. We tell people to use prescriptive communication with themselves. Like, I don't know what less means, right? Less means I eat chocolate 12 times next week instead of 14. It's less, but it doesn't really have much impact. So you have to go for impact. So our diet's pretty specific that way. So we tell people live on starchy foods as the basis of that's where your calories come from, fruits, vegetables, some minimally processed foods, animal foods 3 times a week, wild caught or organic if you're going to do that, no more, no dairy. Cut the oil because it's just a source of calories and most of our people are overweight when they show up. So stuff that has 14 grams of fat per tablespoon won't help you much there. And then treats for holidays and special occasions. I mean, I like birthday cake, but today's not my birthday, so I don't get any. And it's not New Year's Eve, and it's not Thanksgiving, and it's not a holiday. And, so people are hurting themselves by celebrating 4 or 5 times a day, 365 days a year. And we'd like to relegate that type of behavior to Passover and Easter and Christmas and your birthday. So those are the guidelines, and we try to be real clear about it. But we tell people you have to make up your own mind about what you're going to do. Any change you make is great, but there is a tipping point where you're going to get benefit, and there's also the giving yourself permission to do a lot of bad stuff, which can keep you in the place that you are.
When I work with patients, I like to look at the concept of epigenetics, which is similar to what Pam's talking about. It's diet, lifestyle, environment, belief system, right? And we work on all of those things because, again, although we want, the diet's super important. Don't get me wrong. It's one of the first things and foremost things because food is medicine or food can be poison in a way. And we all also don't want to get, hyper vigilant and again, get obsessive compulsive or have anxiety around food. But a lot of times people don't understand the power of food, right? Because the doctors are usually in general. I mean, most of my cancer patients, they go to the oncologist and the oncologist or any specialist, and they'll say, eat whatever you want, we treat you, and then if it comes back, we treat you again, right? Like there's a disconnect, I think, in just the conventional medical world in general of the understanding of like, no, patients can empower themselves with education, with knowledge, and with changing of their diet and lifestyle to improve and reduce their risk significantly, right? Because most of the conditions that we see in America, that is our lifestyle diseases, heart disease, diabetes, blood pressure, obesity. These are all just lifestyle diseases. Now, it is easier said than done, right? And it's a challenge because this is why we're stuck in this realm of where we're at. So we have to take our patients and then work on all the epigenetic steps. And it doesn't have to, but you don't have to be a perfectionist in one. And I agree with Pam on that. Like a lot of people want to be hyper vigilant on one thing. Like I got people like who crush the diet, they don't exercise, or they run all day long and they eat, the weekend warriors kind of concept, and good and bad in a variety of aspects. But it has to be a delicate balance. But for me, it's always putting it to the test because what we think, and even as a physician, or even what the science may say, I might say that you must be eating more of these foods. But if they come back and they have a sensitivity that's causing inflammation, or their microbiome, or they think they're eating enough, and here's their diet diary, we really need to test that. And the reason why I do that because it really can give us some really like solid data on then shifting, saying, hey, you know what? You think you're eating enough, but you're not. You need to eat more of these colorful compounds. You need to eat more of these antioxidant rich foods. Or maybe a lot of patients that I see who are plant-based, they think they're getting 30 grams or more of fiber. And when they actually count it out, they're not. Right? Because a lot of people think like, oh, I eat tons of veggies. Even my middle of the road Mediterranean diet patients are people who eat clean. Oh yeah, I'm eating my grass. Oh, I usually get that much. But when they actually calculate it out, they're not. Because the average person, if they're still eating a lot of animal protein or even on a regular basis, there's no way that they're really getting to that 35 grams or more a day for supporting microbiome function and overall health. So there's a little bit of a miss. So if I can push them to say, hey, if you still want this, then you need to maximize eating this as well. And as long as everything else is balanced, and again, all their laboratory parameters are great, that's great. Like that's fine for them. I've reduced their risk. They have lowered their overall risk. It's not just treating symptoms with medications or doing green pharmacy where people also treat symptoms with natural therapies.
Just to be more specific though, if someone said, tell me the exact things I should do, not how to think, what do you tell them? Are you saying like what should we do if we don't want cancer, Alzheimer's, heart disease, chronic kidney disease, and we're going to have the best attitude possible, as specifically and succinctly as possible? What you've been dealing with cancer for a long time. What should we do? Should we drink 8 glasses of water a day? Should we eat a whole food plant-based diet? Should we exercise? Should we take saunas? Should we do colonics? Should we do hyperbaric oxygen chambers? Like, what are the most effective things to prevent us? I understand we can't guarantee it, but from all your experience, is there specific things you would say are the number 1, 2, 3, 4, 5 things that you'd recommend someone does to minimize their risk of getting a disease?
Well,
Well,
what I would go ahead. Go ahead. Go ahead.
well, I'll go back to the list that I gave before, and then we have a 138-page textbook, and we teach a 12-hour course that our people take. I think you bring up an interesting point, which is that everybody wants a couple bullet points that will tell them what to do. And the first thing is, I'm clear when people come to Wellness Forum, I don't want you to do things that I tell you to do. I think the process is what's important, because if you don't know how to read the medical literature and you do what I say, then you hear somebody else at this conference who says something else, and I think that sounds good. That's what they're doing. They're going from this to that, to this to that. I'll try this, I'll do this, I'll do that. They have no idea what they're doing. And by the way, that's why they're in the medical mill, and that's why they get hurt by the medical mill, is doing what people tell them to do. The only way healthcare gets better in this country, one person at a time, is one person at a time learning enough to make decisions and making them based on intellect and logic, not because Pam Popper sure is convincing. I want to do whatever she tells me to do until somebody sounds more convincing, and then they go off on that tangent, right? If people bought houses and cars the way they consume information about health, everybody'd be homeless and walking to work, all right? Because people would take advantage of them not paying attention. It's only in healthcare that people abandon all reason and say, tell me what to do. So I'm not trying to disagree with you that people need specifics, but they really need more than what we can put in bullet points. They need to be educated how to do it. And then they have to monitor themselves. In other words, we have a food pyramid, we have a textbook, we have a 12-hour course, we take you through all this. Then you have to keep food journals and you have to keep an exercise journal and monitor yourself to see how you're doing. Because I'm not moving into your house with you to get you up every morning and make sure you do the right things. I also think, and I think this is where Dr. Pai and I have a great deal of agreement, is that it's important to teach people to have a normal relationship with diet and lifestyle. In other words, your whole life doesn't revolve around all the weeds. We call it the weeds. How much of this and how much of that, and did I have enough celery last week and all this kind of stuff. It revolves around adopting a pattern of living that becomes very natural and that sustains life, right? And the reason for doing it is so you can live your life, not so that you can focus on how many of this and that and how much celery and carrots I ate last week, because that's really a myopic vision of health that doesn't leave a lot of mental space to read and enjoy life and go on trips and have dinner with your friends and celebrate birthdays and do the things that we're here to do, which involve diet and lifestyle, but are not limited to that. I hope that made some sense.
Yes. I mean, what I would recommend everybody, just if you want bullet points, so if you read my book, An Inflammation Nation, I have 10 steps, right? So I do that's something if people want to be like, I want steps to go, like step 1, step 2, step 3. But the idea is like, you could be shifting more towards a plant-based diet, right? You have to be, these are all the epigenetic things. You have to look at environmental toxicities. Like when we look at inflammation, we look at inflammation not only from the food, but we're looking at like, emotional inflammation, physical inflammation, even spiritual, financial inflammation. Right now, I mean, not to show anything, but like right now, this is kind of what what's happening right now, right? Like there's a lot of stress going on. Stress itself is an inflammatory trigger and reaction that occurs in the body. So when we look at like getting the person's inflammation down, their immune system stronger, getting their microbiome kind of restored, looking at exercise, stress reduction, heart rate variability, community relationships, and having sympathy, empathy, love. It's like 10 steps, right? Like how do we reduce certain things like cutting down the alcohol, cutting off the cigarettes. These are things that have become so commonplace now that are kind of creeping back into society due to a lot of stress, I would say. But again, it's not being perfect in any of these things. It's in my opinion and how I look at things is disease is the perfect storm of a lot of little failures or a lot of little upsets or a lot of what we call the stacking effects of inflammation. So if there's a threshold in your body, for example, say your joints, there's so much inflammation, this is normal wear and tear of life. But once it builds up and it crosses that levee point, then you have joint pain, for example, right? And you're going to have fatigue, and then you're going to have brain fog, or you have other kind of dysfunctions. So it's a little bit of everything. And the way I look at it is you want to turn it all down as much as you can, like a sprinkler system effect. We don't need to get a fire hose out and put out and call the fire truck to put out a kitchen fire. You actually will kind of destroy most of the kitchen. You want to have a little bit of a sprinkler effect, and that's the best way to do it. You start turning it down. So when I have people read my book and they go start on step 1, for example, which is moving towards a plant-based diet, they don't have to be completely plant-based before they go to number 2. Right? Like I agree with Pam. Like we have to have people learn that it's steps, right? But it's not just like, well, what's the top 3? I mean, I think even when we sometimes get these questions, it's so reductionist that people then even think like, well, gosh, if that's easy, then why do we still have problems? Because you can still have problems. There's still 10,000 chemicals that we're going to get exposed to that we don't even know that we can't even test for. I mean, just last week they took out the Clean Water Act. How is that going to do for everybody in America, right? Terrible. right? So we have to look at like we want a risk reduction of what we can. Let's drink some, put an RO system if they're coming, try to eat more, as healthy, organic as much as you can. But a lot of these things don't have to be expensive either. I don't want to hear, I always hear this argument, oh, if I go plant-based, it's going to be very, very expensive. No, rice and beans is probably the cheapest food right now that you can afford, right? And so we have to really shift this concept of like being healthy is either elitism and the common person just needs to eat meat and potatoes, or they don't know any better. It's just no, we have to teach them like where are you getting, what is a phytonutrient, what is fiber, what is antioxidants, what's inflammation, where are environmental toxicities coming from, what triggers heart disease, what triggers insulin resistance and blood sugar and diabetes problems. And if you kind of just get those basic ideas, which is going to be one of the lectures I'm giving next weekend, then it's like everything just gets better. And you don't have to, again, be extreme, but you could be like, I'm getting better and I'm lowering and reducing and increasing some of these good things. And then all of a sudden it's like, oh yeah, my blood pressure medicine's less. And I got off my metformin. Oh no, I started losing weight. I always challenge my patient to move forward, and some people can do it immediately, depending on their condition and depending on their motivation. But I like to work with patients like as a coach in terms of like I take everybody to the Olympics. I want them to get gold. Some people are satisfied with bronze. That's fine. But I like to go for gold. And the reason being is because most people at the end of the day have never felt optimum wellness. They've never had it, they can maybe remember 40 years ago. I remember just feeling good, right? And then life came, right? And we all have it, right? And goods and bads, and there's all things, even economic stress, physical stress, family stress, taking care of parents, taking care of children now, sandwich generation. I get it. But the idea is that we have to give people a little bit of hope, education, and guidance. And when we do that, all of a sudden things start to build. They start feeling better. They start feeling empowered. And then it's easier to do larger shifts when we start having these small changes to start with.
So Dr. Esselstyn had a concept called that you could become heart attack proof by eating a whole food plant-based diet with no oils. And that was a really likable concept because it gave you a really great thing to strive for, that you change your lifestyle and now heart attacks become almost a non-risk. One, is that something you agree with? And two, what about cancer and dementia? Like, how much will lifestyle decrease your risk? Does it decrease it by 2%, 20%, 90%? In other words, we'd like to just, know if it's worth it. I mean, it takes a lot of effort to do push-ups. It takes time to jog. It takes, French fries taste good, but it's worth it if it prolongs your life and keeps you healthy. What is the actual science and data say about how much less likely you are to get a real health issue if you follow an optimal lifestyle?
Well, Pam just mentioned right now, right, that the studies will show, which all the studies will show, like longevity, longevity is there when people are more plant-based. So we already know that, right? But when we talk about Esselstyn, I'll give you an example. So Esselstyn's patients are unique because when they were at the time of seeing him, they already had to go through the conventional system and fail it, right? It was a last resort. And that's how the system does it. Like unfortunately, they don't send people to Pam, me, or even Dr. Esselstyn first. The system's like, well, we will give you stents, we'll give you statins, we'll give you this bypass. And then when we're running out of issues, then you can, that's just how, unfortunately, these systems run. But what I see is here is like, yes, can you make someone almost heart attack proof? Yes. Making sure their lipids are really low, like their LDL below 70. I don't see anybody having heart attacks outside. We check their particle density. We see whether they're producers or absorbers, because there's other things outside a diet that people can have high lipids, that are even vegan can still have high lipids. Either they're producing or absorbing too much fats, for example. We also can look at stress, because remember, I wrote a little section in my book which showed examples of, in 2008, I had a series of patients, and one had elevated lipids. They all had elevated lipids. Some of them had normal lipids, and they were all financial hedge fund managers. And then when the market crashed in 2008 due to all of their trading and whatnot, they all had heart attacks. But their levels were completely different because that was a stress-induced issue of triggering an inflammatory response, right? So we have to understand that, is anybody heart attack proof? Well, can we get their risk of the blood flow and the vascular flow to be the best so that doesn't get clogged? Yes, but they still have to work on other outside factors that contribute to heart disease, like mood, emotion, happiness, exercise, stress. If they have high stress, you can have clean vessels. So I give you an example. Marathon runners, right? They're the ones who actually have the highest rate of sudden cardiac death. They go all and then they die. They just drop dead. Now, cardiac function wise, they should be the healthiest because they're running marathons. But their stress level, they have the worst heart rate variability in terms of the electrical impulse in between each beat. They're the most stressed people. So exercise is a state of physiology. It's not a state of health. And so we have to be careful when we talk about these parameters of making someone, heart attack proof. Now, with his patients, reducing the oil, for example, is important because those people have already had stents, bypasses. That means through all this treatments and all the drugs, they still haven't changed their diet at all. Right. So for him saying, hey, if these people are, say, for example, in the Midwest, they're going to go to a restaurant, you can't go to a restaurant and say, low oil. It's going to be heavily fried, most likely, or heavily plated with oil. So the no oil for those patients was an easy way for them, because they're not cooking at home, to go out really and then just kind of reduce the risk. But when we see patients, I don't put people on a no oil diet, even my patients that have heart disease, because in certain cases, certain patients who are vata, they're more dry, they have from an Ayurvedic perspective, like they need oilation. But we're not talking about saturated fats. We're talking about healthy plant oils, like having little avocados, a little bit of nuts, or a little little bit of those things, a little bit of olive oil. Now, not a lot. A lot of people are pouring it all over themselves. They can't lose weight because they're just saturating themselves with tons of fat calories. So again, there's extremes of people using these kind of concepts. But going back to answer your question, now the last thing on the cancer and the dementia risk, I'll just give you an example. Study just came out last week. Pam must have saw it as well, but looking at microplastics in the environment, and they're showing now with the patients with the dementia, we have about 1 plastic spoon of microplastic in the brain, right? So that's not necessarily a plant-based versus carnivorous diet. Although we did have studies that showed more recently that there's higher microplastics. This is what I'll be talking about in one of my other lectures. Is that's because it's bioaccumulation in animal protein. So my organic tofu still has microplastic. Bad for me. But what's worse is someone eating grass-fed beef or wild-caught fish, or because there's just more microplastics because of the bioaccumulation. But that's a global problem. So I don't want to be like, oh, I'm better than you or you are better than me. It's like a spoon of plastic in their brain is not good for anybody, right? We don't have anything to detoxify or remove out of the body. So when you say like heart attack proof, we can heart attack proof a patient from the diet of the normal cholesterol and inflammatory responses. But most recently, when they did endarterectomy studies about 6 months ago, they showed 80% of the plaque in the endarterectomies had microplastic. Right. So again, that bioaccumulation in the animal protein that has cholesterol so there's now another contributory factor to heart disease or vascular clogging that is actually not just the animal protein. Even if it was clean, this is just that the rain goes up, but has microplastics, goes back down on a grass-fed field or on my organic tofu as well. Right. So we're all getting exposure. So this is what I don't want to always hear, like, well, I don't want to ever have this. Can you prevent it? It's like, well, there's a lot more complexity in life, but we want to reduce these things. So it's always about risk reduction. But again, if you're looking for perfection, then that's just the fantasy that people will say, I'm not going to have this problem, and then they're going to have a problem.
Okay, thank you. Um, Dr. Popper, you mentioned that too many raw greens could potentially lead to kidney stones. Can you clarify that? And is this with raw greens or cooked greens? Could you
I'll
clarify?
clarify it for you. I never said it. And so
Okay.
there's no raw greens, cooked greens, all these ratios and all that. It doesn't make any difference.
So
So that one's easy. I never said that.
there's no problem with greens. You can have as much as you want and they don't cause kidney stones. That's not an issue.
Right. Yeah, I mean, that's the last thing I'd want to do is have somebody rationing how much green food they ate. We want them to eat more, not less. We very seldom have people coming in we have to tell them, you know what, you are just eating way too much salad. I've never seen anything like it, and we've got to back that down and get you to eat some other stuff instead. So no, we want them to eat as much of that as possible.
Okay.
When we look at our patients, so when we do the nutrition testing, we're actually able to measure the oxalic acid markers on the patient and levels. And so we do see people eating high animal protein, super high, especially if they're keto, that can be high. So that obviously puts them in the common risk factor of having kidney stones. But on my subsection of plant-based patients, those who are on the extreme raw side, since they're just doing raw greens, they actually have elevated oxalic acid markers and levels. And so that also can put them at risk. But the simplest, easiest thing to do for that is just steam or cook your greens. So it doesn't mean that everything has to be cooked, right? I just tell them like, well, hey, if you're eating this every day, why don't you steam it? Why don't you cook it? Well, you can even, the studies even show just blanching it, right? But remember, I always tell my patients, over centuries and millennia of evolution of our microbiome, we did invent fire for cooking. So we shouldn't forget that, because how our microbiome has adjusted over time was also to have some cooked foods. So cooking is not a bad thing, by the way. Now, but again, it's a small percentage. So Pam's right. Like, we want everybody to eat as much as they can, because most people are not even getting close to, I think it was like 95% of the people don't even get a serving a day of greens, right? So yeah, we're talking about like little tiny uh, outliers.
Okay. One controversial topic is how much fat to have in our diet. There's many people at the Real Truth About Health that say no salt, to have an SOS diet of little minimal salt, oil, and sugar, and to minimize fat, and that the fat is blocking the cells and I'm explaining it wrong, and the sugar can't get into the cells. So anyway, there's many people saying minimize your fat, including fat from plant sources like too much nuts, seeds, avocados, and olives. And then there's other people saying absolutely not. This is a key food, and have lots of avocados and lots of raw nuts and lots of raw seeds, and lots of raw olives. Um, what is your thought on avocados, raw nuts, raw seeds, and olives?
Well, I want to start with this idea of minimize and lots. Nobody knows what that means. All right. So prescriptive communication is very important, because I can say I'm eating less fat and I'm having 100 grams a day today, and I had 120 yesterday. I'm still going to end up fat and sick. So we have to get away from that, and we have prescriptive rules. And again, I teach by analogy. If I told you Wellness Forum opens in the morning at 9 o'clock, except for the days when we don't do it, nobody would know when to come to Wellness Forum, right? So the whole world operates on rules, and then we jump off into this diet thing, and it all gets so fuzzy, and try this and try not to do that and eat a little more of this. Nobody knows what it means. So I think the first thing is that the level of restriction or rules about anything is determined by the health of the person. So I agree with Dr. Pai that Esselstyn's diet is for people who are out of options. But when I have a 35-year-old who needs to lose 10 pounds and his cholesterol is a little high, it's an inappropriate match, because we're not likely to see compliance at that point in time. He's not scared half to death like Esselstyn's. So the rules, if you want to call them that, are going to be a little bit different. So one of the things that we do, getting back to this prescriptive communication, is the problem with oil is it has 120 calories a tablespoon and 14 grams of fat per tablespoon. Most of my patients are fat when they arrive. I hate to use that term, but they are. So you're not going to get unfat eating concentrated fat, copious amounts of it, particularly in foods where it doesn't make any difference, like the 3 tablespoons of olive oil that you use to start the soup. You can saute the onions and garlic in water and end up with the same flavor, right? You don't need that oil. So we do get the oil out of the diet. It's an easy way to defat the diet, and nobody ever misses it once they do it. And then toward the top of the pyramid, because we do use a pyramid, you eat less of the stuff at the top and than you do at the bottom, are the higher fat foods like nuts and avocado and foods of that nature, right? And for those things, you use them when they're part of a dish. But a cup of avocado has 21 grams of fat. And people will visit the grocery store, take home 5 avocados and say, now, what am I going to do with these, right? And then they eat it every day. So they have avocado toast for breakfast, and they've had a cup of avocado, 21 grams of fat, 3 tablespoons of olive oil on their lunch salad. And they say, I don't know why I keep getting so fat. I keep getting fatter and I'm eating plants, right? So use those foods when they appear in a dish. So I make a great chickpea salad with avocado. I buy an avocado at the grocery store. I come home, I make the chickpea salad, and that avocado ends up being part of 4 or 5 servings of chickpea salad. That's an appropriate way to use it. I make a great pad thai, by the way, and if you crumble up nuts and put it on top of it, it is delicious, but I'm not putting my hand in the bag and eating cashews. That's how people end up fat, calorie-dense foods that they eat copious amounts of, not understanding the calorie density of those foods. If you looked it up, most people, if they looked it up, they'd eat a lot less of it. So we don't have to take it out. We just have to have prescriptive rules for how to eat these things so that people don't end up in trouble. And by the way, one thing that Dr. Pai mentioned was when people visit restaurants, we teach people, and I've done this for years, restaurants will make anything that you ask them to make. I got a low-fat vegan meal at the IHOP in Marshall, Texas a few years ago. And I tell people about that because if I can eat a low-fat plant-based meal at the IHOP, I think you can probably do it anywhere if you just ask people really nicely. And I remember I told the waitress when I went into the restaurant, I said, it was the only place in walking distance from the hotel and nobody was coming to get me for a while. I said, I eat a vegan diet. She said, I don't know what that is. I said, I'm not surprised, but I can tell you. And they made me a beautiful salad and quesadillas. And she said, honey, you can't pick up those quesadillas because there's no cheese to hold them together. I said, that will work out just fine. And so, there are ways to negotiate this and navigate this whole thing, no matter where you are. If you understand how to do it and you have the basic concept of what that pyramid looks like in your head, right? You can do it anywhere, even in Marshall, Texas at the IHOP.
What I like to do when we're talking about the excess of oils with the patient is, since we test those things, and again, the reason why I test, because how much we all want to reduce, but everybody's perception of how much they eat, again, can vary, right? Like what is a lot or a little bit to everybody is slightly different. So when we look at someone's omega-3, 6, and 9s, for example, and also whether they do conversion or not of those things and then get it from their diet, if their omega-9s are high, which is avocados and olive oil and stuff like that, and their complaint is I want to lose weight, or they are obese, for example, then it's easy to show them like you're of what you're eating, it's just too much. Because because they don't notice that, since it is a high nutrient, caloric dense, liquid, it just goes right down to the bottom of your stomach. A lot of people, they kind of complain of carbs with the weight gain, like, oh, I go to an Italian restaurant and it's the pasta, it's the bread. And I go, no, it's like the 1,000 calories that you put in the little nice, beautiful olive oil with the herbs that you dipped with the bread that you filled up 2 or 3 times before the meal came. Because that's just the heavy caloric density of foods that doesn't make you full. There's no fiber in it. Doesn't stretch the stomach receptors. So you can still keep eating those things. So it is something that unfortunately it has been sold as a health food. They even have the word superfood on the bottle. It is not a superfood. It's a refined food. Now, it's not terrible if it's used appropriately, but most people are inappropriately using it because they're thinking that they're going to get healthier by adding more. Now, if I have a patient, for example, that's underweight, that's going to be a different story. If a patient has more vata in their Ayurvedic dosha, then we'd be adding a little bit more oleation to the diet. But if they're coughing, they're having a little bit of obesity, they even have unctuousness of their skin, they're already having way too much oil to begin with, and we would want to reduce it. So it's always about individualizing the diet, but also measuring it and testing it. And also looking at their omega-6s, looking at their omega-3s and saying, are you in an anti-inflammatory state or a pro-inflammatory state? And again, this is something that, again, to show them, because visually a lot of people say, Dr. Pai, you use a lot of data, because data drives people. I can tell them all they want. Pam can tell them, we can show them all the studies, but sometimes when they own their own information, like patients feel so great when their lipids go all the way down to normal, when their A1C goes all the way down to normal, when their blood pressure goes down to normal. It's a pride, because this is where I see all this effort that I've been doing that no one's told me about, that now I have been empowered, I have been educated, I've changed my diet and lifestyle. These are lifestyle changes. So it's not a quick fad. And what Pam said is exactly right. Like, we need to motivate people and give patients steps so that they can move in the right direction. And depending on how motivated they are, we still have to keep encouraging them, because at the end of the day, the less of the drugs, the less of the side effects, the less of the doctor's visits, the better.
But okay, forgetting about oil, I understand that. when it comes to nut, Dr. Furman said that the studies show that people doing nuts and seeds have less disease. He was saying that you should make sure to incorporate nuts and seeds into your diet. So what I'm questioning is there an amount of avocados? And he was also saying that the heavier you are, the worse it is for your health. So that he was saying to have nuts and seeds, but not to the point that you have weight gain. But I'm asking in your research what you have found regarding the impact on health of just three things: nuts and seeds, olives, and avocados. Is that something that at some point will clog my arteries? Will it cause a heart attack? Will it cause stroke? Or are you saying it might make you gain weight, but this is generally a healthy food? Or are you saying, no, it's no different than any other fat and you want to avoid it if you can?
Well, I think the first thing is that good foods, bad foods, broccoli is a great food, but if you have it once this year, it's not going to do any good for you at all. And brownies are not so great, but they're not going to hurt you if you have them twice. So it's a dietary pattern that becomes the issue. And two nuts, a handful of nuts once a day, 4 times a week, it's in the pattern of eating. That's why it's so important for people to see a scheme of eating instead of individual foods. And it doesn't matter what the individual foods are, by the way. So people choking down cashews or a Brazil nut after lunch, I've never seen anybody where a Brazil nut was going to be the difference between their having a long lifespan and not. And if they're that precarious, they probably don't need to be in my office. They should be seeing an emergency room physician. So that's the first thing. It's not how much of each food and a particular food is important, what is the ratio of everything? Teaching people the ratios of foods, where does it fit in the diet? And for people that are overweight, 65, 70% of the people in this country qualify as obese, probably more than that right now. And so eating more calorie dense food is not the answer to that. Doesn't mean you have to give it up, but let's move it up the scale to this tiny part of the pyramid where you're not eating so much of it. And a prescriptive rule that says when I'm making a dish, I put it in instead of saying, try not to eat too much of it. What does that mean? I ate a half a bag instead of a bag. Well, I didn't eat as much, but you're still going to be overweight. The other thing is that high fat diets cause the body to produce more LDL cholesterol. So you're going to gum up the machinery in your arteries and you're going to end up with higher LDL cholesterol by eating a high fat diet. That's the condition that they're often in when they get to us, right? So they don't have to get rid of nuts. It doesn't have to be no nuts, and it doesn't have to be no avocado, and it doesn't have to be no olives. But how about we use those foods in dishes that require them and stop putting our hand in the cashew bag and buying 5 avocados at the store at 21 grams of fat per cup and figuring out what to do with them when we get home. That's when I get in trouble.
Yeah, I agree. When I think it's like portion size and portion control, because when I have patients and they go to the big box store, they're buying a canister literally of nuts. Right.
Yeah.
And we're stressed, we're doing work, and they're just sitting at the computer doing, and so that's where, it's not Spring's not using it as an ingredient. They're just using it as a snack all day long. There is one oil, though, I do want to talk about that was in the research studies last year and in Europe coming out of when they were looking at all the different type of oils, right, and testing, what the problem, because remember, too much fried foods, too much vegetable oils in the diet is just an omega-6, right, which is pro-inflammatory. And again, the average person's about 20-1 in the ratio. Some places in America is about 70-1, which is crazy. So it's more inflammation, right, omega-6 to omega-3. So the omega-6s are really high. We want to reduce that, right? There's just an overconsumption of that. And the oil, so even being vegan, right, or plant-based, people can have, too much fried foods, right, because that's all, or potato chips or whatever, right? So we want to start reducing that as much as possible. But the palm oil, out of all the studies that they were looking at in terms of metabolic tissue of the muscle and any kind of interference, although all the oils, we want to reduce, palm oil seemed to be the one that actually had the highest level of creating insulin resistance in the muscle tissue, meaning blocking the glucose uptake. And the interesting thing is, we see this nice data coming out of India, where some of these countries, even in the United States, most of our snack food, most of the cookies and candies, even some of the plant-based foods, plant-based butter or whatever, it all has palm oil. It's the cheap oil of this decade, and it's terrible for the environment, terrible for the animals, terrible for everything else that it has to do with the industry. but it's cheap, so everybody's using it and they feel it. But there's a strong data correlation of once the introduction is of those things, there's even a higher rate of insulin resistance and diabetes for those people who get exposure to that. So, I always tell people, even if you're plant-based or even if you're going and you look at those plant-based options or there's a cookie or something, even a snack, if it says palm oil, put it away because these are things that are sneaking in people's cupboards and pantries and some of these other condiments that is like, well, how come my A1C is slowly going up? And these are things that actually, in the day that when they did muscle biopsies and studies showing like out of all the oils, the palm oil seems to be the one. And again, we didn't have that 20 years ago. We didn't have that 30 years ago as much as we do today in the food supply.
A couple things I'll add to that. Don't have those things in the house. That's another thing too. I'm a firm believer in choice architecture. I don't, tonight when we finish this, it'll be pretty late. And if I have a hankering for cookies or something processed or whatever, it isn't in my house. So if I want something sweet, I've got bananas, dates, pears, apples, and probably a couple of other things like that, apricots. That's it. I have to get in the car and go get it. So keeping this stuff out of your house is part of the key to this, and not tempting yourself all the time and trying to control yourself. The other thing, you're absolutely correct about the palm oil wasn't around 20 years ago. Where that came from is the campaign to get rid of trans fats, which they did, and they replaced them with tropical oils. And so now we have a lot of saturated fat in snack foods like cookies and that sort of thing. So it made things worse instead of better. And the only reason I bring that up is there's a lot of talk right now about government intervention in manufactured foods. And every time the government gets involved in regulating, they make things worse. And so I don't think we're ever going to solve the problem that way. I think we solve the problem by educating people to make different choices. And so don't buy something with palm oil. You're right about that. But replacing palm oil with something else, which could be the next thing, they'll come up with something worse for sure, right? So let's just teach people, if you have a cookie with palm oil on your birthday, you're probably not going to die. If you've got a shelf in your pantry allocated to that kind of stuff, you're probably going to get in trouble after this session tonight.
Tomorrow morning at 9 o'clock, Dr. Gabriel Cousins is speaking. He's about 81 years old. He reports to be in very good health and does push-ups and dances and seems very good. He also is saying for some people to take a teaspoon and a half a day of a very high quality salt, saying that table salt has been heated to 1200 degrees, but the actual mineral salt from the mineral beds actually has benefits. And that for certain people who have adrenal fatigue or have their ratio of sodium to other minerals out of balance, he's saying that this is something that would be beneficial. And I would be happy to do it, but I'm also have heard people say that salt causes strokes and heart attacks. So is it a good idea to follow what Dr. Cousins is saying and take half a teaspoon 3 times a day, followed by water of a high quality salt? Is it increasing my chance of a stroke? Is it going to help me with if someone has adrenal exhaustion? Is it going to help their ratios on the charts, the hair analysis test that compare your ratio of salt, sodium to other things? What is your thought about this advice that he's offering?
I think it's better for people to just use salt in their diet. This salt-free business is not a good idea. I've had people hospitalized, and we see it in the hot yoga room. It's the worst place to be on a salt-free diet because they start to sweat and they get worse. And I have a hot yoga studio in my place. But I don't. The more complicated this all gets, I agree with him. Salt is an important nutrient, and people need it. They need some salt. I don't think that 3 times a day with a teaspoon, half teaspoon and water, and this just is more rules to follow. It's better. People like salt on their broccoli and rice, and if the salt will make them eat broccoli and rice, I'm like all for it. Restricting salt often makes it difficult to get people to eat some foods that we'd like to see them eat more of. So I think just using a high quality sea salt on foods that are good to salt will take care of that without having another ritual to follow, which tends to go away and get replaced by another ritual at some other point in time. Just make it, again, I'm all for just making this much more easier and natural.
It should be, in my opinion, culinary, not as a supplement like, oh, I'm taking it, so many times a day, like that he's doing that. One of the things though that I would say, if looking at environmental toxins, because this is again the problem for everybody now going forward in the last decades, and now that there's less regulation, even more of environmental toxins, it's going to be a problem. But when we look at salt, there's differences in types of salt. So I only am a proponent as much of getting is like the Himalayan salt, actually that's mined from the mountains. The reason being is because of the purity of the salt. So the most recent studies showed, in terms of when we look at microplastics, is that sea salt, which is the generic salt that most people will get, even at restaurants, I saw some of the day like, oh, I got French fries that says now with sea salt, or whatever. It's the fast food restaurant and all. But they found out that the sea salt has the highest amount of microplastics. Why? Because that's the ocean water that we're just drying and dehydrating. And so part of those little crystals actually have the highest amount of concentration of microplastic. So again, trying to eat some things which again, maybe 50 years ago wasn't a problem, maybe 100 years ago wasn't a problem. These are issues. And so avoiding just regular generic table salt, like the one with the little lady and the little umbrella, that's really good for your driveway when it snows, like, or your sidewalk. So you can put those kind of salts over there, but you really want to be looking at salts that are kind of more, I like to have them more mined, just to reduce that. Now, if you ever put those kind of salts on food, you actually will put less salt on it. And Pam is exactly right, to make it taste better. I always try to have people try to buy foods, if they're buying especially packaged foods, and if there is a no salt or low salt option, always to go for that. Because if you need to add it, you will always add less than that will already come pre-packaged, because salt is the generic preservative of food, even in plant-based foods, especially frozen foods, and it's super high in salt, right? And that kind of generic sodium chloride that is just put in there, that's the regular table salt, that does cause elevation of blood pressure and swelling. And most people, when they eat packaged, especially packaged frozen foods or snack foods that have a lot of salt, then they end up tendency having higher blood pressure and those kind of issues. And so then they're taking blood pressure medicines or diuretics or whatever. The idea is that the average person, when they eat out, or they eat too much packaged foods, it is heavily loaded with salt. And so if we can shift people, which we like to do, Pam probably does this as well, we're looking at trying to teach people how to cook, go shopping with them, easy recipes, things that they can actually do at home, which is a lot cheaper now than going out to get a meal. That's the best way. And then you can salt your food. But for everybody who's trying to be no salt, the SOS free, I have just as many patients who are SOS free who have cancer, who have other problems, right? Because they come in, these are extremes of, when you look at say a blue zone person, right? They're not SOS free, or they're not doing hyperbaric chambers or colonics. Like, look at all the patients and people around the world who live the longest, who are the healthiest. They're not doing these trendy kind of radical, or just kind of sounding like I can purge this out of my body type of thing, or over treat it. It's like, what are you doing? Are you doing the epigenetic changes with diet and lifestyle? And if you are, your longevity will be better.
So is salt, though, high quality salt, the highest quality you could get, is that a safe thing to have in your life? Or is it a risk to stroke and heart disease? Like,
It's,
for years we've been told that. Is that a
it's
risk or not?
no, about 5% to 6% of the population is actually salt sensitive. And for them, it's a risk. All right. I have people who hold water. They retain a lot of water when they eat salt. Their blood pressure goes up, but it's a tiny percentage. And one of the flaws, I think, in the diet and lifestyle movement is that a diet, going back to Dr. Esselstyn's patients, that is appropriate for a person who's had 2 heart attacks and 3 bypass surgeries is not the same diet that you're going to recommend to somebody who's 35 years old and just wants to live a long time. So for some people, salt restriction is necessary. For the vast majority of the population, it's not. And in terms of the quality of the salt, I mean, I deal with a lot of people in Council Bluffs, Iowa, who are getting their salt at Costco. And we have to deal with the reality of what people like this have access to and will do. And again, let's not make it harder than it needs to be. And I understand what you're saying about the microplastics, but we don't really know at this point in time. And one of the confusing parts about trying to find out is what impact, if any, that has. One of the difficulties is people are so unhealthy and overweight and over-medicated right now that it's difficult to tease out what, if any, impact that's having. But I would make a prediction, I'd be willing to stake my net worth on it, that if we could get people leaned down and eating a health promoting diet wherever they're sourcing that food, even if it is sea salt that comes from Kroger that isn't refined and doesn't have all the additives and everything else, I think we would get rid of most of the disease in this country. I think that Dr. Pai and I would have to find some things to do with our spare time if we did that. And people would be able to deal with some environmental toxins. The problem is overload. They're overloading themselves with so much, including the body fat that they're wearing, that they have. They can't tolerate anything. But I think if we focus on the big stuff first, the body fat, the dehydration, the lack of exercise, the lack of sleep, the bad diet, the too much processed foods, too much animal foods, let's deal with all of that. And I think that's where we're going to get the most traction.
And to go back to further look at how we can also reduce the excess, because you remember a lot of people just use salt as a flavoring agent, right? And as we get older, we lose a little bit of our taste and our smell, so people heavily salt their food because they're trying to taste the food. But what we want to look at, or what we like to work at, is all these things behind me, is teaching people how to use spices, right? There's one that's where, and this is my opinion, so I don't want to, get into trouble like I did before many times in this conference saying things. But when I go to plant-based, facilities or plant-based conferences and all, sometimes the tendency, particularly when they're really like whole food plant-based, is that yes, they got the right portions of the food, they got the right sources, organic, whatever, all that's great. But to me, it's really bland. Because what a lot of people here don't really know how to do when they're shifting over is no one's teaching them how to use spices to make the foods more flavorful, to make the food more healthier as well. Because it's not just the fruits and the vegetables, the seeds and nuts and grains and legumes. It's that we have to look at all the 50 or more spices that we have in the cupboard that most people may not be familiar with because we've been eating out a lot. But those are the things that also have antioxidants and phytonutrients and cardiovascular and blood sugar and cancer benefits of lowering of risk of diseases because they have these phytonutrients. These are, most of the plant medicines that we give coming from plants, right? So this is just something that I want to tell people, like if we use a lot of those spices, then there's less just generic salt intake that's needed, right? Don't get me wrong, we still use a little bit, but a lot of people heavily because it's just really like they don't know like what they have salt and pepper and that's all they've been kind of told and that's all they have at the table. And so there's a little bit of an education and that can be really fun. We do cooking classes, for example, at our center, and then we also teach people how to make spice blends and other things like that. So it's like these are things that they can kind of put on their food and that actually adds more medicinal value in addition to culinary taste value.
Yeah, I agree.
There's a lot of people on this call that you don't know anything about their health, you've never met them. And if you were just speaking to people, you have no idea who they are, what their age is. And the question is, yes or no, should they, one, get a mammography? Should they, two, get a colonoscopy? Should they, three, get an annual physical? Those three things. We are told, yes, you should get a colonoscopy. Yes, you should get mammographies regularly. And yes, you should get an annual physical. Is that something that you also would recommend? Or do you have something different to say to people that you don't know? So you can't give specific advice, just in general, what is your thought about those three things for people?
In general, for most people, the annual exam is a waste of time. And it's become an opportunity to hunt and hunt more and more and more for abnormalities, most of which don't make any difference. I've been in this business for 30 years and we used to see blood tests that were 3 pages long, maybe 2 pages long. Now we get them in a UPS box. That's how much they're measuring. Well, the more you look, the more you find. I'm going to be 69 years old this year. And if I went to a doctor and said, listen, I want you to hunt and hunt and hunt until you find something wrong with me, I'm sure they can. But the question is, what does it matter? I weigh what I weighed when I graduated from high school. I can run a 9-minute mile for an hour and I take no drugs. What the heck am I doing hanging out with doctors saying, see if you can find something wrong with me? I think it's a terrible idea. And the data back me up on this. And even the designers of the Obamacare plan, which makes that free, forget the guy's name who worked on that. He writes for the New York Times. He says it's a waste of time and money, even though he mandated it as part of the Affordable Care Act. Mammography does not reduce the risk of dying of getting cancer or dying of it. it does reduce or increase the risk that you will be diagnosed with what they now call stage 0 cancer. They actually have a different term for it. And a randomized controlled trial just came out showing that the difference between women who were treated for their not cancer versus not treated for their not cancer, because it isn't cancer, no difference in deaths at the end of the follow-up time. So there's no benefit to mammography unless you're doing it for diagnostic purposes. And I would argue there are better diagnostics than mammography. We didn't have any data really on colonoscopy until 2022, when the Scandinavian study was published, and it showed that there was no benefit to colonoscopy. It does not reduce your risk of colon cancer, it doesn't reduce your risk of dying of colon cancer, and it does not reduce your risk of all-cause mortality. So would you get a colonoscopy for diagnostic purposes? Possibly, but it depends on the situation, because sigmoidoscopy might be a better option. It's far less invasive. So no, no, and no in general, unless there's something specific that has to be addressed.
I look at these things as screening tools, but again, they're diagnostic. And so she's absolutely correct that it's not preventing disease, it's detecting disease. But in the population that I see, most of these people have already had those screening tests, and therefore their following is their pathogenesis of the disease or their issue. So if someone has colitis, these are diagnostic. If they're bleeding, they're diagnostic. There's other tests that we would look at, though, in terms of screening tests, that if patients don't want to look at those things, there's tests now that is given through Mayo Clinic and all these other things like that that can screen for cancers now. Again, nothing's perfect. But the challenge that I have is that, and although I am a big advocate of doing a physical exam, or at least someone doing a physical exam, because most people hasn't been looked at. And most people are not, at the end of the day, are not good historians of noticing bumps or lumps. Now, again, Pam is right in one way, because it's a checkbox where they're actually not really doing a physical exam. It's probably it's the medical record they just check. Because I see patients all the time, and it has this like 12 things checked, and I was like, in a 7-minute visit, they did all of this. No, it's just the EMR that's checking, and they're billing the higher code for doing a full physical exam. That has kind of been lost, the art of doing a physical exam and looking at physical diagnosis in medicine for the last 50 years. But I think there is an aspect of actually doing a physical exam, or at least when we look at it from an Ayurvedic perspective, or even a Chinese medical perspective, there's things that we can assess with the patient, right? By pulse, by tongue, by vision, by actually seeing certain aspects. And even when I have patients like walk in my office, I can assess by them walking down the hall certain parameters, right? Rather than just having them show up in my room, or people kind of do that. They stuff them in rooms and then they kind of go room to room. We miss a lot of observation of the patient, and that's kind of even lacking now. And unfortunately, when I do a lot of telemedicine as well, or consultation, I miss that. And it's good that I can provide more of my education and guidance. But physical exam, that's a lost art. There's an art and a science to medicine, and I think that's kind of been taken out since we have been pushing a lot of diagnostics, and it can lead to too much diagnostics. So Pam is right on one level. A lot of the conventional system is just becomes a routine of just doing more and more tests. But I like to make sure that when we're doing those things, like it's, to me, if patients are not taking care of their health and they're not motivated to do any kind of change, then it can be a tool of correcting that lifestyle, right? Because sometimes it's like, this showed this. I have a couple of polyps and I had a little bit of inflammation in my colon, da 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 da. That helps them, or helps me help educate of how we can now then change their epigenetics correctly. And then if they get the colonoscopy again, it can be clear, right? Because all disease has a reversal to it. And so for me, I use those screening tests because most people have them by the time they see me, usually positive tests, that how can we improve that function and formality? Again, just like a lab test, it's another diagnostic test of where they're at that point in time. And I like to look at it and then how that we can improve that function or form.
Okay, last question of the night. If someone came to you and said, okay, I went to the doctor and unfortunately I was diagnosed with cancer. And they stayed calm and they didn't rush to make any decision, and they spoke to everyone they knew and got advice and understood everything. And they came to you and they said, okay, what do you recommend I do? What would you tell them? Do you recommend chemo and radiation? Do you recommend watchful waiting? Do you recommend cutting it out? Like what is your general advice for people that unfortunately have a diagnosis of cancer?
I think the worst outcomes come from people who say, I'm going to do only conventional or only alternative. I think you don't want to categorize things that way. So the first thing we tell cancer patients to do is calm down and don't make any decisions unless there's some emergency. You've got a blockage and you have to take it out, right? But most people are not in that situation. Gather data before you do anything. And the first thing is let's look at outcomes data for what your oncologist is telling you to do. And there are some times and some cancers where oncology offers a very good solution. Now, that doesn't mean you won't do some other things too, because we have to look at why did you get this cancer? And if you don't want to get it back, then you have to change your weight and your habits and all the things that we've been talking about this evening. But you don't want to throw the baby out with the bathwater, and some cancer treatments are effective. Some cancer treatments are effective when used judiciously. Maybe some chemotherapy, but not all of it. Maybe you don't do any of it until you get yourself in better shape. We've sent many people to fasting centers, for example, to take a lot of weight off, get their body in better shape, and then you have surgery, and then perhaps you have a little bit of chemotherapy. There are a lot of alternative medicine options depending upon the type of cancer. But again, it all has to be customized to the person's attitude toward risk, the type of cancer that they have, finances, unfortunately, because insurance doesn't pay for much other than conventional oncology, even if it doesn't work very well. But this is where I think for the cancer patient, it is super important to be informed and to know how to read the medical literature, because a type 2 diabetic that doesn't make changes can come back a year later and still live happily ever after. A cancer patient who doesn't do the right things doesn't get a do-over, because cancer can be a very aggressive disease, as we all know. So it's super important for the cancer patient to make informed choices. So we ask our cancer patients to watch our videos. We have 20 some videos on cancer, the causes of cancer, diet and cancer, certain alternative treatments in cancer. We teach them how to read the medical literature and investigate options that they're interested in. And it works best, I think, when cancer patients have a committee of 2 or 3 people helping them to make decisions, so that the burden is not on them for everything. So, but again, the wrong choice for a cancer patient can be fatal. So it's important to be very deliberate and to know what you're doing before you start anything.
When we see cancer patients, again, we look at all the epigenetics, we look at the data, we look at also plugging in the parameters. I always ask for a second opinion, right? And then what type of cancer, where it's located. There's different facilities, even in conventional medicine, that would be better than others. So that's where, it's not just so if I'm using conventional oncology, which we do a lot in our practice because people consult me from other places, then I'm like, okay, then you need to go to this place because it's the place that does that type of surgery better, or they have a better type of proton beam therapy for that type of tumor. But when it comes to then therapies itself, we have to also plug in like the risk benefits. When we look at natural therapies, or we call like integrative cancer supportive protocols, we look at like mechanism of action, contraindications. Is there in our when I look at a patient and I provide protocols, it's like everything is evidence-based. So we have to make sure there's in vivo, in vitro studies on that patient's type of cancer. And then can we actually then find that product that was even studied, and can we provide it in a dose that would be as therapeutic as possible? Is there any synergistic effects with their chemo or immunotherapy and radiation? And is there any contraindications that we also have to remove or eliminate or start at a different time? That's a subtle nuance that most people don't do. A lot of people will say, do all this, don't do that. That's what oncology say. And then on that, the natural will say, take all this stuff and don't worry about it. You can't detox yourself out of cancer. You can't sauna. You can't colonic. So it's not a purge. It's not a cleanse. There's a lot of those things. Those things don't really work at all. We're always looking at doing the same thing that we would do with the patient that doesn't have any other type of problem that's a cancer. It's the same epigenetics. You got to get the inflammation down. Got to get the immune system up. Get the microbiome stronger. Got to get the stress down. right? So it's just the physiology knows how to take, the body has an innate ability to heal itself. You just have to give it the environment to do so and the tools to do that and the support. And if you do that, the patient has a great outcome. But when I see a patient, they're coming in at different stages. So it's not always as easy saying, oh, I have an early stage, or they're usually coming in, they're already in midst of treatment, right? So it's on how do we improve their outcome by looking at an evidence-based approach. It's not all or nothing or this versus that. I think there's too much of that. And that's when the patients have bad outcomes, when they only just are in one camp. I think Pam's exactly right. Like, you have to really look at what's the evidence. Like, I had a patient yesterday, she came in, for example, she has a breast cancer. She's going to get a lumpectomy, which is indicated. It's very small, that's her choice. But when we plugged it into the calculator, they're asking her for a hormone blocker, and the data showed, and this is conventional data, it showed that there was no statistical change or effect of her taking that hormone blocker for 5 years, right? Now, if there could be an argument, maybe not statistical as significant, but there would be some kind of argument that at least someone may argue. But when it's not, then there's a system where, like, they're telling her something, but the data shows that in actuality, in her case, when you plug in all her parameters, it didn't show that kind of benefit. And this is where we have to keep challenging the system, because I do have patients all the time where conventional oncology sometimes will throw out terms and data, just like regular doctors or alternative doctors. They like to throw out percentages, but they're just terms. They're not actually applying patients' data to, like, certain specific medical calculators so that we can actually assess real-time risk with their data. And I think that's the best way to guide patients for better outcomes.
Okay.
One comment I'll make about that, and then two comments actually. When you get into these aromatase inhibitors, the data are so terrible. For example, the hormone blockers for breast cancer patients, it's a 2.8% reduction in real terms, absolute numbers. So I tell people, I know everybody thinks they're special, but you're probably not the tiny number, the tiny group that's going to benefit from this. And by the way, the reason why they're given these aromatase inhibitors is because their estrogen levels are high. And where's that coming from? Their body fat and the dairy intake and the fat intake. So you can have the same effect as an aromatase inhibitor with weight loss and the right diet. The other thing I'll add, and I think this is really important, I think the mindset of cancer patients is important. We've gotten to the place where we can pretty much decide, we can tell who's going to live. Some people have really dire diagnoses and they're just intent on living. And a book I recommend every cancer patient read is Radical Remission by Kelly Turner. The stories of 1,000 patients, the results of her 1,000-patient study on terminal cancer patients who survived. And the people who read that book get hopeful. Their families get hopeful, which is great because outlook is everything. And they become very determined. I've seen people who were so passive, it terrified me because passive people die of cancer, who have completely come to life and become different people as a result of exposure to that material. So the cancer patient has to adopt a survival mentality. I'm going to live because I've decided I'm going to live. And there's a placebo effect and a nocebo effect, and they both really go to the same thing. And that is, you get what you expect and you get the outcome that you expect. And expectation for a cancer patient is super, super important.
Okay, so if anyone, Dr. Pai and Dr. Popper are both going to be speaking more at this conference, please look on the schedule. They're both going to be on another panel, and they're both giving 2 lectures. So to get the full version of everything that they share, please make sure to watch their lectures and their other panels. Dr. Popper and Dr. Pai, if you would each make a 30-second closing comment, then we will end it.
You want to go first?
Go ahead.
Well, first of all, thanks to Steve. What a great forum you provide for a lot of people to learn a lot of stuff from a lot of different people. So I'm forever appreciative for this opportunity. I think the second thing is that really what you've been hearing about is the same thing. You got to pay attention to your diet and lifestyle, and you've got to pay attention to your health if you want to live a long time. And most people neglect their health until they reach a crisis. I hope this is a message to pay attention to your health so that you don't end up in a crisis situation.
Thank you. Thank you.
Steve, thanks again. This has been the 5th year I'm coming back, so I appreciate it. And I keep on getting more lectures, and that means that's a good sign. I also want to make sure that everybody knows that I actually can help people. Pam can help people. We're available. We do consultations. We see people from all around the world. It's really about, again, it's not us against them. We got to avoid this kind of, competition kind of idea. It's looking at how we use evidence-based practices, evidence-based data, and data-driven. And we want to look at how, when we use conventional medicine, how we can actually use it with less side effects and more targeted effects. And then can we actually change the epigenetics and diet and lifestyle so that we don't need it, right? That food, our lifestyle becomes the preventative protective effects. But we help people where they're at, and hopefully they follow what we listen to and they're interested. And we have other lectures coming forward that will go deep diving into other natural therapies. But I do appreciate everybody taking the time to listen.
Thank you. Can we unmute everyone? Thank you both very much. I appreciate you coming, and I hope everyone else will take a moment to thank you as well.
Thanks,
Great.
Sam.
Thank
Thank
you
you so
so
much.
much.
Love you.
Thank you.
Love you.
Thank you.